Hello everyone, today I will present about obesity and my name is Betsy. First, what is obesity? Overweight and obesity are defined as abnormal or excessive fat accumulation that may impair health. Overweight and obesity is a little different. Overweight is a condition in which your weight exceeds the appropriate threshold for your current height. Obesity is a phenomenon of excessive and abnormal fat accumulations locally throughout the body. Obesity negatively affects human health. Usually people use BMI to measure obesity, and there are three levels of obesity. First is level 1, low risk obesity. If BMI is 30.1 to 34.9. Level 2 is moderate risk obesity. If BMI is 35.0 to 39.9, and level 3 is high risk obesity. BMI is equal to or greater than 40.0. How this obesity spreads. Now that fast food chains became popular because they were eye-catching and appealing but low in nutrients. People do not care about the importance of nutritious foods because they are not as addictive as fast and greasy foods. Families is an important part of teaching children about the important foods and they can control their diet scientifically. In the chart, we can see the predicted probabilities of obesity. The symptoms of obesity. For others, excess body fat accumulations, shortness of breath, sweating or snoring, trouble sleeping, skin problems from moisture accumulating in the pores of skin, inability to perform simple physical tasks, fatigue, pain, psychological impact, and with children, eating disorders, facing issue disposes, the appearance of stretch marks on the hips and back, accentuates, recurrence, shortness of breath with physical activity, sleep apnea, constipation, GI reflux, poor self-esteem, early puberty in girls, delayed puberty in boys, orthopedic problems. You can see through the three pictures in the present, and you can see the when the obesity you can see the skin problem. This and in the skin will have stretch marks. Second is sleep, usually more than normal and like the summers in the Japanese they can breathe when they sleep. Breathe up for others who define overweight and obesity as follows. Obesity, a BMI greater than or equal to 30, with children under 5 years of age. Obesity is weight for height greater than 3 standard deviations above the whole tribe growth standard median. Children aged between 5 to 19 years. Obesity is greater than 2 standard deviations above the whole growth reference median. Which country are affected? The countries are affected nowadays in American Samoa, Tagalog, Nauru, Cook Islands, Palau, Marshall Islands, Tuvalu, New Tonga, Samoa. In the map, we can see the most of the countries affected in the Americas and Asia. In the US, and we also have British. How much percent of population affected? With the Americans so much, there are 7.16%, Tagalog 7.4%, and Nauru 61.0%, Cook Island 55.9%, Palau 55.3%. The reasons we get from obesity, which also people will cause more disease like high blood glucose or diabetes, high blood pressure, high blood cholesterol, and triglycerides, heart attack due to coronary heart disease, heart failure, and stroke, bone and joint problems. More weight puts pressure on the bones and joints. This can lead to arthritis, a disease that causes joint pain and stiffness. Stop breathing during sleep. This can cause daytime fatigue or sleepiness, poor attention, and problems at work, gallstone and liver problems, some cancer. We can see in the picture we have normal fat and, and after obesity it becomes differential fat. In the normal fat we will aim to macrophage is the blue one and CD4 T cell is the purple one. We have the blood vessel and adipocyte in the yellow one. You see in the normal fat the vessels run in normally and didn't be stuck by anything. But and it is produced anti-inflammatory adiposity. It didn't it not cause cardiovascular disease, but in dysfunctional fat, the vessel, the blood vessel stopped by macrophage who want and in the dysfunctional fat there is necrotic lipocytes appeared and surrounded by macrophage cloud-like structure that produce pro-inflammatory adiponectin and thus cause cardiovascular disease. Regions with economic nearly 40% increase in health provision spending, more than 70% increase in treatment spending in comparison. Around 20 studies published in the 1990s close to 7% of the overall healthcare expenditures in the US and an estimate of more than 3% of the national healthcare spending in other countries, which were included in the report. The prevents. First, we must limit energy intake from total fats and sugar. Don't take the sugars become main source foods in the day. Increase consumption of fruit and vegetables as well as legumes, whole grains and nuts. And engage in regular physical activity, 60 minutes a day for children and 150 minutes spread through the week for adults. This is so I take the information from to make the present.